Looking at me, you probably wouldn't think that I'm sick. You would never guess in a million years that I actually have kidney failure. You wouldn't know that every day is a constant battle, and every night is a never-ending reminder of what my life has turned into in the past year. On my 16th birthday in February, I started realizing that something was wrong with my body. And then I went to Texas Children's Hospital, and by June 2010, I was diagnosed with FSGS. FSGS stands for focal segmental glomerulosclerosis, and it is a chronic kidney disease that usually leads to kidney failure. After kidney failure, you either have to go on dialysis or have a transplant. According to the NephCure Foundation, FSGS can be broken down to mean focal meaning some, segmental meaning sections, glomerular into kidney filters, and sclerosis is scarred. So it can be broken down into some sections of kidney filters are scarred. According to the UNC Kidney Center, we don't yet know why most people develop FSGS, and in order to be diagnosed, you must undergo a kidney biopsy. You must be seen by a kidney specialist called a nephrologist after you realize that something is wrong with your kidneys. And according to the NephCure Foundation article called FSGS Facts, FSGS is idiopathic, which means it arises without a known cause, so researchers are actively trying to learn more about this disease. They currently know that more than 5,400 patients are diagnosed with FSGS every year. NephCure estimates that there are currently 19,306 people living with end-stage renal disease due to FSGS, and it is the second leading cause of kidney failure in pediatrics, which is children. Approximately 1,000 FSGS patients a year receive kidney transplants. However, within hours to weeks of a kidney transplant, 30 to 40% of all of the transplants lead to recurrent FSGS. In order to try and battle the disease, they use steroids, which are immunosuppressants, and they suppress the immune system and try and slow down the effects of the disease. But as UNC Kidney Center tells us, all the drugs that they use as immunosuppressants come with significant side effects that most patients don't like. They say that if not treated, patients develop complete renal failure and require dialysis or a kidney transplant just to survive. There are two different types of dialysis. There's hemodialysis and peritoneal dialysis. I'm currently on peritoneal dialysis, and I have to dialyze 10 and a half hours each night until I can get my transplant. Hemodialysis is where you go to the clinic and you go for at least 3 times a week, and you stay for about 4 to 5 hours each time you go. Peritoneal dialysis offers more flexibility, and you can do it at home, and you do it at work even, wherever you need to go and however you need to do it. According to DaVita, one of the largest kidney care companies in the U.S., PD uses a thin membrane called the peritoneum, which lines your abdomen, to perform dialysis treatments. During treatments, a cleansing fluid, which is called dialysate, or a dextrose fluid, which is like a sugar solution, is put into the patient's abdomen through a small flexible tube called a PD catheter. In conclusion, FSGS is a chronic kidney disease that you have to have a biopsy to diagnose. After you have kidney failure, you either need to be on dialysis or get a transplant just to survive. Right now, I am awaiting my transplant evaluation, where they test your blood tissue, test how your body reacts and how it would react, and test your immune system so that you can get a perfect match for your kidney. And hopefully I will get that soon and be off dialysis and not need to be dependent on a machine to stay healthy and just to live every day.
Awesome.